Come back to the polls. Now, next week, Ghana will join the rest of the world to mark International Neglected Tropical Diseases Day. That will leave the country with just 6 years to achieve its target of ending NTDs by the year 2030. NTDs include elephantiasis, woolly ulcer, which both have become devastating social and economic consequences for communities, families, and the nation as a whole. This year, the observation will be under the theme 2023, the year to shine a spotlight on NTDs and the suffering they cause, and to call for comprehensive and universal care for those affected by them. It's our collective responsibility to confront inequalities and put an end to these diseases that are entirely preventable. This afternoon, we built up to the day by finding out what we all can do in helping end NTDs in Ghana. In the studio with us is Dr. Joseph Opare, Programs Manager for NTDs at the Ghana Health Service. Doctor, you're welcome.
Thank you.
It's a pleasure to have you here.
Yeah, thank you so very much. And
so,
it's good to come back.
Great. So, when we talk about NTDs, first, let's talk about the spread.
Okay.
We've spoken about elephantiasis and woolly ulcer. And I know over the years from the Rawlins's time, there's been consistent fight against woolly ulcer. Are we winning it?
Yeah, somehow we are winning it. We are winning that. But I must also go back and say that neglected tropical diseases are a group of 20 preventable and treatable diseases. These diseases are found in certain parts of Ghana. They are caused by various pathogens, I should put it that way. And we have 20 of them, but in Ghana we have 14. 14 so far have been identified. And we know where these cases are.
14 tropical diseases.
It's neglected tropical diseases, right.
All from the ones I mentioned.
Yeah, elephantiasis
and tuberculosis.
Exactly.
So elephantiasis can be scary.
Exactly, it should be. And, you know, these diseases disfigure. Okay? If you have legs so big, there's little you could do, right? And that may make you disabled. And if you're not able to do work as expected, definitely you wouldn't have the funds, salaries to take care of your family. Eventually, these conditions may lead to poverty. There's also stigmatization over here. But the good news is that these diseases are preventable. You did mention Borrelia ulcer, elephantiasis, lymphatic onchocerciasis. We have soil-transmitted helminths. We have schistosomiasis. We have leprosy. We have yaws. We have cutaneous leishmaniasis. We have rabies. And we have sleeping sickness, right? That is it.
So why do we call them neglected? Is it a case that we have decided and won't focus any attention on it?
You know, it's one of them. There's low risk perception. It's like somebody with big legs, elephantiasis. Somebody may think that, no, I cannot get this condition. And also on the global health agenda, sometimes we hardly talk about neglected tropical diseases. These conditions also do affect the poor, people in the poorer communities, where sanitation water is scarce. See? So, and most of the time, these people with these conditions hardly come out. Okay, they
talk about it.
Yeah, talk about it, and also come out to, the crowd. Let me put it that way.
And why is it so? Is it because of stigmatization or what? Because I spoke earlier about elephantiasis.
Exactly.
If you are infected by it, it will be difficult for you to be associated with people.
Yeah, and that's what we see on the screen. It's quite devastating. But the good news is that we can prevent all these conditions. That is the good news. We can do that through mass drug administration, especially with the preventive chemotherapy in neglected tropical diseases. And these are onchocerciasis, lymphatic filariasis, schistosomiasis. We have soil-transmitted helminths. We have trachoma. Trachoma is a thing of the past now. And we have another group that is preventive case management, neglected tropical diseases. Have the leprosy, Borrelia ulcer, yaws, and so forth. Okay, for these ones, you have to go and look for the cases and treat them. But the other ones, you go into the community.
You are able to identify.
You are able to identify, okay, map them. Then the entire community will be treated, whether they have the condition or not. So these ones, you can prevent them.
So earlier, you spoke about some of the causes of people who live in unhygienic areas.
Or sanitary conditions.
Exactly. And these are mostly people who are poor, the poorest of the poor. And they are infected by things that are sometimes hard to treat, but preventable. Exactly. So where are they most prevalent?
Well, in Ghana, we have, if you take onchocerciasis, we have about 140 districts currently endemic for onchocerciasis. If it's about lymphatic filariasis, we have 116. But the good news is that we've been able to fight that, okay, to only 7. So when we do mass drug administration against lymphatic filariasis, we are dealing with 7 endemic communities. Schistosomiasis is found almost everywhere in Ghana, right? And soil transmitted helminths also the same, right? Leprosy, we are looking at 195 endemic districts. Borrelia ulcer, we are looking at 98. Cutaneous leishmaniasis, we are looking at 2 regions.
Really, it's still an issue.
It's still
after
an
all
issue.
These years.
Yes. But the good thing is that when it comes to diagnosis, we are better off now, okay, compared to what happened some years ago. And treatment is also good. Yeah, so that's why for this day that we are celebrating, World NTD Day, we want to say that these conditions are treatable and preventable. So we want everybody in Ghana to know that we have neglected tropical diseases in Ghana, 14 of them. So we don't have to keep quiet. And these cases could be prevented. That's why we give the free mass, we do free mass drug administration on some of the conditions. We also want to say that neglected tropical diseases have impact among the individuals and also the community. When you are poor, what can you do? When you are devastated by these conditions, what so much can you do? When you are disfigured, what can you do? And there is, NTDs also have impact on stigmatization. That's the crucial thing. It could lead to mental distress and all that.
So what, from the Ghana Health Service perspective, what is the strategy to tackle it?
Yes. So with the preventive chemotherapy and neglected tropical diseases, as I mentioned earlier, onchocerciasis, lymphatic filariasis, schistosomiasis, the worms, okay, trachoma, it's all about mass drug administration. So we do mapping in the communities. Okay, as I said, like onchocerciasis, we have 140 endemic districts. So we do mapping, locate where these conditions are, and we treat the entire communities.
Is it an ongoing exercise?
It's an ongoing exercise. And as I speak now, there is an exercise on that when on onchocerciasis is being treated in about 100 and about 77 endemic districts in Ghana as we speak.
And how is it going in terms of progress? Is it encouraging?
So much. So far, it has been good. It has been good. Yeah, and we hope it will be better next time.
So for people who are affected, treatment is free. Is that the case?
That is it. Mm-hmm. Okay, and that is what we are trying to achieve so much. If you have lymphatic filariasis, all right, elephantiasis, right, we are supposed to be at the health facilities. We teach you how to manage that. Okay, if you have onchocerciasis, that one may lead to blindness. If you have also lymphatic filariasis, you may end up with a condition called hydrocele, right? And that one, we always look for funding to do free surgeries for the affected ones and the other conditions. So prevention is free. We have medication for prevention. Okay, but when you're affected by the condition, that is where sometimes the problem is.
So in case of the prevention,
yeah,
the free aspect of it, is it by the program or let's say it's captured under the health insurance?
Yeah, it's by the government.
Okay.
Government's intervention. Okay. And when you are affected by the condition, that is where now we are trying to push it into the health insurance scheme. So that all people affected by neglected tropical diseases, they go to the health facilities and they are treated free of charge. So this is what we are pushing now. But if it's about prevention, we give free medication for that. So you don't have to get sick. That is the caveat. Because the preventive mechanisms are there. Then also back to your question, what we are doing. There's an aspect we call morbidity management, disability prevention, especially when it comes to lymphatic filariasis. So for that one, those affected, we manage them. We teach them how to wash their wounds. We organize free surgeries and so forth. Then, of course, we do health education about these conditions, like what we are doing now.
So the target is what? To do outright elimination or bring it to the barest minimum by
We are
2030?
heading towards elimination.
Are we on course?
We are on course. You are aware that guinea worm, guinea worm is also
Yeah.
a tropical disease. It's no more, right from 2015. Okay, trachoma, right from 2018, is no more. Sleeping sickness, by the grace of God, and also with your support and the government, we don't have it now. It has been eliminated as a disease or public health problem, right this year, 2023, and last year, 2023. So we are on course. When it comes to onchocerciasis, the prevalence, the prevalence of the infection has gone so low now. Okay, we've tackled it almost 95% to a level of about 95%. When it comes to lymphatic filariasis, as I said, 116 districts were endemic, but as at now, we have only seven of them to tackle.
That's encouraging.
So we
actually asked about the progress,
yes,
because of the factors that contribute to the rise in some of these ailments, including poor water and poor environment.
Exactly.
I mean, water supply in the country has become a challenge. Even here in the capital, I mean, they are virtually rationing it. Now, if you go to some of the catchment areas that you spoke of, illegal mining has also contributed to make the water even more poorer.
Exactly.
Exactly. So when I asked about the program, I was looking at, as we are moving on, the factors is getting even poorer. So in terms of progress, are we likely to be the target?
Not poorer per se.
Because of the current situation that we have.
Things will get better. Like, cast your mind back so many years ago when it was about water supply. Is it not better now?
Exactly.
Yeah. So if we have that, of course, we can get rid of trachoma, and we don't have trachoma now. Sanitation, on and off, but it's getting better than before, right? And so forth.
What about the illegal mining contribution to
that one? When you have environmental changes, okay, Gorilla ulcer, okay, in the wet places and where there has been changes in the environment, that could facilitate that, okay? But there hasn't been any kind of link. Mode of transmission is a bit vague now, but it's kind of associated with that.
Right. So, Doctor, what do you expect the public to do?
All right. So now we want to let everybody know in Ghana and beyond that, well, in Ghana we have neglected tropical diseases still persist. We have 14, right? And we have free medication for that. So everybody should get himself or herself involved in the mass drug administration whenever it happens, and also repair the disease condition. Onchocerciasis, as I said, currently is ongoing in mass drug administration. Lymphatic filariasis will come off very soon. School deworming exercise is also another point, right, and so forth. But the other thing is that if you have the condition also, do not sit in your house alone. Okay?
Very important.
Get closer to any health facility and you could be assisted. Then again, most importantly, all hands should be on deck. Commitment from each and every person into the program. Because if you are not able to do that, these conditions will persist and all the achievements made so far may not help. Things may reverse.
And then by 2030, the expectation that we'll clap our hands and say that we've eradicated all of this.
We should clap our hands. The global goals should be achieved. And what are these goals? Number one, we expect that all those that we are giving mass drug administration should be reduced by 90%, meaning that the prevalence of these conditions should go down so much, right? Also, when it comes to disability, adjusted life years, 77, there should be about 75% reduction when it comes to neglected tropical diseases. You see? So the quota in neglected tropical diseases should go down, down, down. In other words, people should be healthier. Okay. Then we are looking at eradicating at least 2 of these conditions by the year 2030.
And what are those?
Guinea worm is a big candidate.
Yeah.
And maybe yours, because it's very simple to get rid of yours, right? Then by 2030, we expect that about 100 countries should have eradicated one, okay, neglected tropical disease.
And I guess you are doing it in partnership with your international partners.
Exactly.
And I believe that the funding is coming as it should.
Well, they are supporting, but we need more.
You need more.
We need more. There should be an internal kind of.
What about the commitment from the government of Ghana?
It's not bad. At least we get our salaries paid. We have a place to work, okay, and so forth. Encouragement, and they are also helping us get more partners, right? So we're also on course, but we need more.
So the message this afternoon really is that if you have the condition, there's no need to stay home.
Exactly.
And be shy about it.
Go to the
because
health
there's treatment for you.
Yes. Okay, we can prevent it. We can prevent the condition. So get closer to a health facility. If you have the condition, you'll be managed. But when it comes to mass drug administration, get yourself involved in that. There should be commitment from each and every person so that we get more funding into the program, so that by 2030, we should see most of these conditions eliminated in Ghana.
All right. Dr. Opare, thank you very much for coming through.
Yeah, but one last thing.
Please
We are kind of celebrating World Neglected Tropical Disease Day to create this awareness, right? And this year, we want to move away from Accra a little bit. We've been staying in Accra for long.
So where are you going?
So we are doing it at Adesu.
In the Eastern region.
Grand Durbar at Adesu, where we shall call health workers, community members, everybody who matter, okay, to come and listen to issues on neglected tropical diseases, create awareness, get more support from partners so that we could eliminate this condition. So come Monday, all of us are going to Adesu for that function.
And Adesu is in the Eastern region.
In the Eastern region. That is a West Upper Akim district. Yeah, but the actual day for the celebration worldwide is on the 30th
of this month.
But ours will be a day earlier.
So on the 30th, we'll draw more attention to...
Draw more attention.
Yeah.
Even not on the 30th, start from now.
Start from now.
As we are doing. Yeah. Let people know.
But the Ghana Awareness Creation event is on Monday at Adesu in the Eastern region.
It's on Monday. That's where we are going to have the Durbar. All right. So throughout this week, we are doing that. And the theme is very simple. We are saying that we should unite. Okay, all hands on deck. We need partners. We need other people so that we can get rid of this condition. And we should act effectively. See, there should be kind of a commitment from each person, country commitment, local commitment in terms of technology. And we should be able to eliminate this condition. What does it mean? The achievements we've made so far, we have to talk about them. Like, as I said, guinea worm is no more. Sleeping sickness is no more. We also have trachoma. We have to talk about that so that people will be encouraged to support us more, get rid of these conditions in Ghana.
Target is 2020, and we'll do our bit to also help you, to help the team achieve this target of complete elimination.
We should. Exactly. We should, because it's possible.
All right. Thank you very much, Dr. Opare, once again for coming. And on Monday, we'll meet you at Adesu for the national events.